I don't know if Hillary Clinton saw your documentaries on weed, Dr. Gupta, but you famously changed your mind on this. Tell me why there are real benefits to this stuff.
Well, first of all, I also agree that more research needs to be done. I think everybody agrees with that, although it's very difficult to do in this country, and I'm happy to talk about that. But let me remind you, Brooke, that marijuana has been used as a medication, was used as a medication for a couple thousand years, even in the United States up until 1943. It was part of the formulary from which doctors would prescribe medications. It was there, and there was research at that time to support its use. Even now, we have certain medications, something known as Marinol, which is a marijuana-based medication, which is available in the United States. Another medication known as Sativex for patients with MS is available in 20 countries around the world. So there's a lot of research that's already gone into many of these things, although much of it admittedly not happening in the United States. We talked a lot about the use of marijuana for epilepsy, for example, and seeing some of these children who have responded to the use of medicinal marijuana when other drugs didn't work was quite astounding, and I think that stimulated more research. Let me tell you, the reason why not, Brooke, is sort of as fascinating medically as it is socially. It is a Schedule I substance. And what that means, just wrap your mind around this, what that means is that it is categorized as something that is among the most harmful substances and also has no medicinal use. It's preordained as having no medicinal use. So you can imagine a researcher who says, look, I want to study this, I want to get funding to study this, I want to go to the various agencies to get approvals to study this, and the answer comes back, well look, it's Schedule I, it doesn't have any medical use, that's not going to be a very fruitful laboratory experiment for you. So it's just very difficult in the United States to do these types of studies. So I agree with Secretary Clinton when she says that more research is necessary. Part of the problem though is that it's just so challenging in this country at this time.
Can you just remind me before I let you go, what was the #1 reason why you changed your mind?
Look, when you look at the United States research, what I think you see ultimately is a pretty distorted picture. Most of the studies aren't actually looking for benefit, they're looking for harm. They're not getting the approval to study that benefit. For me, it's when I started looking outside the country, when I started looking at laboratories that were not dependent on federal funding, when I started listening to this chorus of patients who I had previously dismissed as malingerers and people who just wanted to get high, and I realized that they in fact not only were getting benefit from this, but oftentimes getting benefit when nothing else had worked. That started to change my mind, but then it also prompted an 18-month journey around the world to go see these things for myself. And now I believe that I think it can have real benefit to people, and sometimes it can be beneficial when nothing else has worked. And it's improper to withhold it as a result. And by the way, I think Secretary Clinton said the same thing. In certain situations, it may have real merit.
Yeah.